Greetings everyone. I am Dr. George Paul, consultant endoscopic surgeon from Paul's Hospital. We've been using LIMAS equipments, the morcellator, the isolation bags, the new isolation bag called the PNEUMOSAC. We've been using that also lately with the latest modifications, which we are quite happy about. So this is, I think, the 2500 ml size PNEUMOSAC. So how we open it up is you hold the bag with the right hand, take off the label with the left hand. So you have a introducing probe as well along with this. So what you do is you hold the tip and introduce into the abdominal cavity. So you hold the tip of the bag and introduce into the abdominal cavity. Push all the way in. Push it all the way in, and then slowly rotate the probe in the opposite direction so that it loosens up from the bag. And then once it's inside, you can just simply rotate it in the opposite direction, anti-clockwise, and then pull it out, and the bag goes completely inside. And once the bag is inside, the easy way is to do what to open up is to basically so keep it on the pelvic cavity, hold the tip of the tail, and then simply pull it. It completely unrolls the bag itself. If you want to unroll it further, you can introduce an instrument and just simply push it in. But most of the time, I don't think that last part is required. This much space itself is more than enough. And the new modification is that he has introduced this, I think, titanium sort of similar metal sort of wire along the opening, so which keeps it open and patent. So it's much easier for you to introduce the myomas or the specimen, whatever you're trying to take out. And the bag is also quite tough enough. So once the tissues or the specimens are introduced into the bag, you can just hold the edges together and then just pull it out through the incision. Once that is done, you can introduce your morcellator and then introduce the scope through the tail, which is again an easy process due to the specific design itself. You pull the tail all the way till this junction, make an incision here, introduce the scope, and insufflate it. Once that is done, till now we haven't had any complication. The tail hasn't twisted or any other problems we've had. So I feel this is quite a good bag to be used on a daily basis without much issues itself. So once the morcellation is done, you take out the scope, you make a tie around the tail. So you make a tie around the tail and then just simply pull this out through the main incision. So as far as our experience is concerned with the bag and the morcellator, LIMAS also has an 18mm morcellator, which is also very effective when you're dealing with large myomas. It really cut down the time that is required for morcellation, and the blade is also pretty good compared to other morcellators in market. So I would say congratulations and good luck to LIMAS